Hello, I am Vidya Kora. The world is a lot different than what it was 6 months ago. We know that pandemics are inevitable, and yet sometimes I step back and ask myself, is this really happening? As physicians, as an association, and as a nation, we need to take an honest look at what happened, how we handled it, and what we need to do better the next time. Because there will be a next time, and the AMA must have a leadership role in our nation's preparation for the future. I want to be your voice in that discussion. I have the discipline, temperament, and attention to detail for this role. I am committed to finding solutions based on science and facts, and I have a track record of listening to others, building consensus, and reaching bipartisan solutions. I am ready to go to work for you. I humbly ask for your vote for the AMA Board of Trustees.
How is your typical professional day divided? Not during this pandemic, but before and after. What percent is spent in direct patient care, research or teaching, administrative or other modes? What will this practice experience bring to our AMA?
I am a practicing internist, and my typical day is divided into taking care of patients in the hospital in the morning, and then I go to the office, and then I see patients in the office. And a significant amount of my time is devoted to paperwork, to returning patients' calls, getting prior authorizations, and a lot of paperwork that we are all familiar with. So because of the practical experience I have in working in the trenches, taking care of patients, both on an inpatient basis as well as in the outpatient setting, and taking care of sick multi-system patients, I can bring that expertise to the AMA Board of Trustees to take care of patients in different settings in a comprehensive way.
What specific ideas do you have to improve and retain our AMA membership?
I think membership has been a significant issue ever since I have started coming to the AMA meetings. The AMA has done a lot of work in this regard. And I think it's important to understand that there is a significant drop-off when students become residents and then when the residents go into practice. So we need to catch that time when the drop-off is happening. And I think we need to use innovative technologies to attract younger physicians to stay involved in organized medicine. And for that to happen, we need to be relevant for their needs. I think relevance is critical. And then we need to make sure that their voice is heard. I have proposed something like AMA Vital Signs, which is like an online polling that can get a pulse on what's going on in our members' minds and seek their input. I think that will be a valuable tool moving forwards to improve membership.
What are your thoughts regarding healthcare reform? Specifically, comment on single payer and public option.
I've always felt that AMA has had good policy. Our house has had good policy in terms of healthcare reform. We have had great discussions. I personally feel that the current pluralistic system that we have in place is a good system where different individuals have options that they can exercise in accessing care. But we want to make sure that the access is widely available. I am in favor of improving the Affordable Care Act by even having a public option on the exchanges, but I'm not in favor of a single payer system. I think improving the ACA, removing some of the shortcomings of the ACA, providing a public option in the exchanges, that way different counties in the past who could not have insurance products will be able to have at least a public option to access care.